Time to talk about the breast exam. What's appropriate versus inappropriate touching during the breast exam? A lot of people had questions about gloves. And so technically, if your skin is intact and there aren't any rashes or wounds, and the doctor's skin is intact on her hands without rashes or wounds, you technically don't need to use gloves. However, most people are more comfortable if the provider wears gloves. Bear with me with this drawing, but let's say this is your neck, shoulder, arm, and this would be where a breast would be. So the breast exam actually starts way up here because your breast tissue is actually way up here. This is called the talus spence. But the proper way to palpate the breast is with the finger pads, not the whole hand. We don't grab, we don't squeeze, none of that. It's just the fingertips. And so most doctors will lightly do this and go around. There is another technique where they will run the fingertips along this way. So some doctors do that. There are other practitioners who like to do this sort of motion. But either way, it's always the fingertips. And there actually is a reason for us to express the nipples. So a lot of people have mentioned that they had their nipples pinched during the exam. And so technically, we are supposed to express it like this. We put the fingers on each side and then press down, and we see if you get any discharge or milk coming from the nipple. Technically, we shouldn't be doing it like this or any pulling. If someone's doing it like this, it may just be poor technique. But really the proper technique is to be doing it with the sides of the fingers pressing down and expressing the nipple. Then there is a portion where we have the patient place their arm over their head, and we do press all the way into the underarm and along the lymphatic chain in the inside of the arm. And so we're just checking for lumps and areas of abnormalities there as well. There are a couple other things to mention. Sometimes there is a visual exam where the doctor will have you place your arms in various positions, or they may have you do a maneuver like this and then bend forward. And so that does help displace the breast so that we can see the chest wall and we can look for any asymmetry between the breasts or any changes. There is another technique where we will have you lie on your side, and that will then move the breast away from the chest wall, and then we can start to feel along the chest wall if we suspect there's an issue there that we need to feel. But either way, the bottom line is that there is no grabbing, there is no rubbing with the whole hand, there shouldn't be any prolonged touching. As a standard precaution, always make sure there's a chaperone present or bring along a trusted loved one.